Welcome to Multisport's informational session, Prevention of Shoulder Injuries in the Throwing Athlete. Whether you're an athlete, a parent, or a coach, this information will help keep your shoulder injury-free this season. Let's begin with the anatomy. The ball and socket joint of the shoulder is likened to that of a golf ball and a golf tee. Because of the size differential, the joint is prone to instability and injury. There are many muscles that cross the joint. These muscles contract to move the arm and maintain joint stability, but the muscles do not work alone. The joint also relies on inert tissues, which do not contract, to stabilize the joint, such as the ligaments and the labrum. The labrum is a soft cartilage which lines the rim of the socket, deepening it and providing added stability to the joint. One motion which is a problem to the throwing athlete is external rotation. Holding your arm at your side and rotating your forearm backwards, it should stop at approximately 90 degrees, as seen here. Due to the aggressive nature of throwing, external rotation often becomes extreme and hypermobile. This places added stress on the tissues which often can't keep up. To prevent shoulder injuries in Little League players, pitchers are limited to the types of pitches they can throw and pitch counts are used. Here's an example of hypermobility in a thrower's shoulder. The best way to prevent an injury is to develop the correct balance of strength and flexibility. This can be accomplished with a thrower's 10. We begin with a piece of exercise tubing which can be purchased at Multisport. With a knot tied in the end, close the knot high in the door. This first exercise is called extensions. With your arm up overhead, pull it down towards the opposite leg, leading with your thumb. Next is flexion in the diagonal pattern. Begin with your arm at your side, pull the tubing up across your body and over the opposite shoulder. Notice we've moved the TheraBand down to the bottom of the door in this exercise. With external rotation, we start with the TheraBand closed in the door at approximately waist height. With your arm across the front of your body, rotate your shoulder outward. Internal rotation is much like external rotation, except for with this one, we start with our arm rotated away from the body and we pull it in towards our stomach. Internal rotation at 90 degrees. We start with a TheraBand tied in the door at approximately shoulder height. Begin with our arm out to the side at 90 degrees and our forearm pointing upwards. Rotate your shoulder until your forearm is horizontal to the ground. Shoulder abduction. We start by standing on the TheraTubing, raising our arm out to the side up to shoulder height with the palm down. Scaption with external rotation. Again, you begin by standing on the TheraBand with your arm at your side. Raise your arm up to shoulder level at approximately 30-degree angle in front of your body, leading with your thumb. Side-lying external rotation is performed with a dumbbell. Lie on your side with your elbow bent. Keeping your elbow at your side, raise your arm. Prone horizontal abduction. Lying on your stomach with your arm straight down, raise your arm parallel to the floor with the palm down. Horizontal abduction with external rotation at 100 degrees. Begin by lying on your stomach with your arm straight down and your thumb up. Raise your arm parallel to the floor, slightly in front of your shoulder with the thumb up. Prone rowing. Lie on your stomach with your arm straight down. Raise your arm, bending your elbow. Prone rowing with external rotation. Lie on your stomach with your arm straight down. Raise your arm, bending your elbow. Pause for a second and rotate your shoulder until your forearm is horizontal to the ground. Press-ups. Seated on a chair or table with both hands firmly on the sides, slowly push downward through your hands to elevate your body. Push-ups with an overpress. Start in the down position with your arms approximately shoulder width apart. Push up as high as possible, rolling your shoulders forward after your elbows are straight. Start with a push-up into the wall, gradually progress to tabletop, and eventually to the floor as tolerated. Perform each of these exercises for 2 to 3 sets of 10, 2 to 3 times per week to keep your shoulders strong and healthy. Thank you for watching this educational session presented by Multisport Physical Therapy and Fitness, located in the village of Liverpool or on the web at multisportpt.com.